Health systems face complex and ever-changing challenges. These are greatest in low-income countries, which typically face higher health needs and faster population growth with lower financial resources for healthcare. Given these pressures, it is important that countries learn effectively from one another. Being able to do this helps governments as they strive to offer more services of a better quality to a larger proportion of their populations, paid for in such a way that getting sick does not push individuals into poverty. With this goal in mind, in 2017, Oxford Policy Management, with support from the Bill and Melinda Gates Foundation, began to look at the why, what, and how of countries learning from the experiences of others. Could cross-border learning lead to healthier populations around the world? And so, Learning for Action across health systems was set up. The study included literature reviews, expert meetings, key informant interviews, and 8 country case studies looking at a broad range of countries spanning Europe, Asia, Africa, and Oceania. The case studies reviewed whether and how evidence from other countries had influenced significant reforms over the last 20 years. Facilitating learning between countries is clearly a complex process. It is more than a technical issue of passing on knowledge. It involves working around political economy constraints and breaking down barriers. Fieldwork suggests that policy stakeholders currently struggle to navigate the jungle of existing information about international experience. Policy stakeholders want to know how to implement specific reforms, not just what reforms to implement. The learning process must be owned by those who are able to act on it. It is seldom effectively pushed and then implemented. It can take a lot of work to make information from one context applicable and accepted in a new context. And perhaps most critically, different countries face different challenges when learning from each other. Even within one country, the challenges change over time. The project's final recommendations emphasize 2 main areas. First of all, the recommendations highlight the significance of national players and the importance of enabling local institutions to gather, filter, and share evidence. Secondly, the recommendations emphasize the need to strengthen a regional health observatory to provide the structure to collate and share national-level learning, supporting its use at the international level. With the knowledge and technology available today, there has really never been a better time to learn.